infertility has a negative social impact on the life of infertile couples, especially women in our today's world. And it's no doubt that women are the most targeted persons when it comes to infertility. They forget to assume that infertility comes from both men and women. I'm so glad that in our today's world that these awareness have been created, that it's not just a woman that makes a couple or a family infertile or not being able to have children. It comes from either from both couples, that's both the man and the woman, or rather from either the man or from the woman. And it's no news that these women tend to suffer from both social stigmas, low self-esteem, depressions, stigmatization that comes with not being able to bear children. Anyway, guys, we are not into infertility today, but we're doing something related to infertility. So in today's video, I'm going to be giving you guys about 5 different tips, or rather some tips on how to conceive easily. You definitely don't want to miss out on this. Let's dive right into this dive. Hey guys, you're welcome back to my channel. It's your girl Smart. On this channel here, we do all about skincare, hair talks, and a little bit of lifestyle. If you're a returning subscriber, you've got a special place in my heart. A new subscriber, you're welcome here, and I really appreciate it. Don't forget to like and subscribe for more interesting hair talks coming in. So in today's video, we're going to be talking about various tips on which you can conceive easily. Yes, various ways on which one can conceive easily. Honestly, I feel that most persons just come out to keep it, maybe probably before trying to conceive within 2-3 months, and there is no pregnancy and infertile, I'm not able to conceive. Calm down. You need to calm down and understand the science and the logic behind it. This brings us to one of our major tips today on how to conceive easily, which is understanding your body and the science and the logic behind pregnancy. Yes. Before you as an individual, as a couple, will say, oh, we are infertile or we are having fertility issues, you need to have had like unprotected sex for at least for a period of 6 to 1 year, 6 months to 1 year. Yes, if there is no visible result, being pregnancy, then you can say, okay, we are having fertility issues, or rather we are infertile. But that being that, there are some couples that, or some persons that their partners are not always around, and when their partner are around, it might possibly be that they have sex around the time where they are not in their fertile window. If you are just seeing this video for the first time, I'll encourage you to check on my previous video when I talked about how to calculate your ovulation period and to know your fertile windows. Yes, I did a detailed video on how to calculate your fertile window, so that will help you to understand today's video very well. Yes, so I said our first tips on how to conceive easily today will be understanding your body and the science and the logic behind pregnancy. Yes, see, some persons believe that the sexual position or you placing a pillow under your leg after sexual intercourse makes you or makes your chances of getting pregnant easily high. No. We need to understand and know something, that the sperm has the ability to remain very motile and still in its active state for about 48 hours. And trust me, you don't show the sperm how to move. You don't show the sperm its way to the ovaries. So you being like placing the pillows under your legs to increase your chances of conception, or maintaining a sexual position to avoid maybe the sperm spillage or leaking out, or probably avoiding not standing up after sex to go wash up because you don't want the sperm to leak out. Trust me, the sperm must leak out. Yes, you need to get up to go and wash up in the bathroom to prevent urinary tract infection. Trust me, you don't show the sperm its way to the ovaries. And trust me, when it comes to this conception, fertility, fertilization, and everything, one needs to understand that it comes with preparing your mind, your body for it. Yes. And I have seen a lot of persons. Yes, I do have a patient before that complained about not being able to conceive. And I asked her, how is your partner? Is he always around? And she'll be like, no, he comes during the weekend. And I'd be like, possibly be you have been having unprotected sex or intercourse on days that you are not fertile. So I had to teach her how to calculate for her fertile windows, how to know her ovulation period and all. So after teaching her that, I needed to explain some certain things to her. And trust me, the number of times, if you are everyday sex couple types, that's okay. But trust me, you don't need to have sex or sexual intercourse 10 times in the day to increase your chances of getting pregnant. Trust me, the sperm has the ability to stay very, very, very alive or motile for about 48 hours. So even just one sexual intercourse can cause pregnancy. Yes, there are a whole lot of things we need to understand when it comes to conception, fertility, and all. Yes. So another thing I found out that most couples or individuals suffer from, or that tends to affect them when it comes to conception, is stress. Yes, there is no way, our body, our hormones work in hands. So there's no way you are in a state of oh, you want to conceive, how am I going to conceive? You are not like calm, you are not in your mental state is not in a state of balance, you are not mentally, physically okay because there is something troubling your mind. Your body works with your mind. There is no way conception will occur. Yes, you need to give yourself like calm down. You need to give yourself some time. If you know some things that you love doing that helps calms you down, if it's meditation, if it's maybe your favorite sport, your exercise, and maybe being with your loved ones, if these are the things that make your mental state stable or calm, but rather that calms your nerves, do them. Just being calm and take your mind off fertility issue or trying to conceive issue, and just let things flow. And most especially, don't have sex because you want to conceive. Yes, that is a mistake most couples make. See, put on a beautiful lingerie, look beautiful, look sexy, smell nice, and go have sex with your partner. Have a very passionate sex with your partner. Don't have it in a way that, oh, you are raising your legs up because you don't want the semen to leak out because you are trying to conceive. No, don't do that. I want you to go with this old lovey-doviness. Just go with a very beautiful lingerie, smell nice as I earlier mentioned, and have sexual intercourse with your partner. Take off fertility off your mind and just let things flow. Yes, just go with whatever reading it is tonight, or rather whatever time. Then most especially I also like to bring to our notice is that we as an individual, the scrotum is outside of the body for a reason. Yes, the semen is being produced outside the body for a reason. See, the semen does not like it hot. Yes, hence the scrotum is found outside of the man's body. See, this if for example that the weather is hot or in a hot situation, this the scrotum tends to like pull itself up, like into the body, not really into the body, but like I hop into the body because it's trying to look for like a cold place. So what am I trying to say? I'm trying to say that you as a man, you also have a role to play in this. You should try as much as you can to avoid like hot baths. You can be on vacation, instead of you having frequent hot baths, you need to prevent that. Yes, wearing shorts that are extremely too tight and not allowing inflow of air or allowing your scrotum to breathe air still has a very, very major effect when it comes to infertility. Yes, it's not only just for the women. And there's something that we nurses or medical personnel advise our patients to do when it comes to fertility. We advise you that when you try to conceive for a period of about 6 months to 1 year, of having unprotected sex, and of which that is the meaning of infertility, and there is no positive result, like there's no pregnancy to show for that, we advise you see a gynecologist. Yes, you should see your gynecologist. I'm not keeping track of the points I'm giving, but I hope you're flowing with me and I hope you're getting me. So if there's any step or whatever point you have missed, you can always rewind the video and I hope you'll be clear. Yes, as I was saying, you need to see your gynecologist, yes, to rule out some certain things before diagnosing or before saying you guys are infertile. Yes, your gynecologist will have to do some check about your medical history, your background, and see if you have had like some past chronic illnesses like diabetes, sugar, diabetes and sugar are sometimes the same thing, BP, you can carry out some fertility tests like checking your progesterone and your estrogen, your FSH, that's your follicle stimulating hormones, and also carrying out some tests like tests for rubella. These are some tests or that can kind of like reduce your chances of getting pregnant. Yes, and most especially the food we eat also has a role. About studies have shown that it has about 50 to 60% when it comes to fertility. We medical personnel will advise that you take your fresh vegetables, fresh fruit, cereals, nuts, as they tend to increase your chances of getting pregnant. So you should leave canned food, processed food, reduce your caffeine if you must take caffeine, just about 200 to 400 or so in a day, but reduce your caffeine, or if you can even avoid it totally, it will be good. But trust me, you need to take your veggies seriously, your fresh vegetables, fresh fruit, your cereals, your nuts. And studies have shown that these have helped to increase the chances of getting pregnant. Yes. And another thing I would like to bring to your notice is stress. Try as much as you can to avoid stress. I know that there are some myths or about saying that exercise can help to prevent you from not getting pregnant or can cause miscarriage. But recent studies have shown that exercise has no effect on preventing you from getting pregnant or causing miscarriage, but not strenuously. That doing things in moderate and doing things overly. You get, if you must exercise, you must do exercises like um whatever exercise you know, but not very, very, very strenuous exercise. And as I said, stress, and there are different ways of you to balance your stressors or your health. If there are any stressors around you, try as much as you can to avoid it. But there are some major ways for you to calm yourself when you are stressed and your mental state. As I earlier mentioned, you can do stuff like yoga, meditation, various exercises that you can make or you can do to help to increase your chances of getting pregnant. So also, I would also like to bring to your notice about because I've been hearing it and it has been circulating about how there are some creams that can help increase your chances of getting pregnant. If you must use a cream, probably like a lubricant, KY gel is a no for me. I'm sorry about that if you have been using KY gel, was a no for me. But if you must use any of these lubricants, you should use lubricants that are free from fragrance. Probably water soluble lubricants, but lubricants that are free from fragrance. Yes, if you can use that as a lubricant to prior to your sexual intercourse. But saying that this lubricant helps to increase your chances of conception, that is a myth. Yes, I don't agree with that. And also, there are also be claims that having an orgasm also helps to increase your chances of getting pregnant. No, that is not true. Although having orgasm is a good thing, yes, makes that feeling is second to none, but that has no effect on conception. See, when it comes to conception, it has to go with your body, your mind together, your body and your mind together. They need to work hand in hand because there are some hormones like your follicle stimulating hormones, your progesterone, your estrogen. These are some of the fertility hormones that helps conceptions to happen. So you should definitely know the kind of lifestyle you keep, stuff like your sedentary lifestyles. And when it comes to smoking, you should avoid smoking. Yes, avoid smoking in order to increase your chances of getting pregnant. Yes. And there's something again, you should also know that understanding your fertile window, your ovulation has a lot of and lot of role to play when it comes to fertility. Yes. So as I earlier mentioned, when your fertile window is you calculating from the first day of your menstrual period to a day before your next menstrual cycle, please, you can go back to my next video. I will leave the link down in the description button below for you to click on the link and watch on how to calculate your fertile window. Yes. So when you start seeing your period, the first day you start seeing your period to a day before your next period, that is your fertile window. You have to subtract 14 days from that day. And as I said, that if you have like a 21-day cycle, 21 to about 35 days is a normal day, is a normal range for your cycle. Yes, for your cycle length. So if you have anything lower than 21 days, I'm sorry, you need to see your gynecologist, you need to see your doctor. Then anything above 35 days, you also need to visit the hospital to see your doctor. So now calculate for your fertile window is if you have, for example, like in 25 days cycle length, you need to subtract 14 days from that cycle length. And if you subtract your 14 days from 25 days, you should be having 11 days. So on the 11th day of your fertile window is when you should be ovulating, and that should be your chances of getting pregnant will be high. So we advise that you start having sexual intercourse within that period, like 3 days prior to your ovulation that day, or even 3 days after. This helps to increase your chances of getting pregnant. Yes. So lastly, another major thing to look at when you're trying to increase your chances of conception is your prenatal vitamins. Yes, your prenatal vitamins are vitamins that you take prior to conception. Yes, it can never be overlooked, or its importance can never be overemphasized. Now, it's always advisable. I personally will advise my patient to take folic acid. Yes, folic acid is one of the prenatal vitamins that tend to increase your chances of conception, your chances of getting pregnant. There are other many vitamins out there, but folic acid itself tends to increase your chances of getting pregnant. Yes, it's advised that you take at least 400 micrograms of folic acid once daily, or at least 5 milligrams of folic acid once daily, as it's always advised that you start taking these prenatal vitamins 3 months prior to when you choose to conceive, or prior conception period. And also there are many vitamins out there. You can also add some vitamins like vitamin D. Yes, vitamin D also tends to help prepare you for conception. Folic acid, vitamin D, there are other many vitamins there, but me particularly, I would prefer folic acid and vitamin D. See, the importance of folic acid can never be overemphasized, as it helps to decrease the rate of these neural birth issues, neural tube issues in babies. Yes, so if you are planning on conceiving, you should start taking some of the prenatal vitamins like your vitamin D, folic acid. But there are some other vitamins like vitamin A, B, E, and so that tends to help to increase your chances of conception. But like folic acid and vitamin D are my go-to pick. So if you're trying to conceive today, or if you are trying to increase your chances of conception, you should go grab your folic acid and your vitamin D and start taking them, as they tend to increase your chances of getting pregnant. Yes. So guys, I hope that I was able to share some important tips. You have picked some of the points, or I know that I was not like trying to give the points one, but I just tried to like say whatever I knew came to mind, and I knew that whatever I said here. So guys, you have come to the end of today's video. If you found this video helpful, don't forget to turn on your notification button, don't forget to click on the subscribe button, and don't forget to share, most especially for more interesting head talks coming up. Thank you.